New research tells us that 9 out of 10 strokes could be prevented. That's because most of the risk factors that cause a stroke are things you can keep from happening. But how easy is it? Renata DiGregorio talked to local experts today. So Renata, tell us a little more about preventing a stroke.
Well, they say it comes down to making lifestyle changes. This may seem like a simple solution, but when put into practice, it's not that easy. But good news, medical experts have some advice and more details that could help you.
The new research found that 10 controllable risk factors make up 90% of the strokes across the world. In our state, strokes are the 4th leading cause of death, according to the DHHR. A family nurse practitioner in Weston says monitoring your blood pressure, cholesterol, not smoking, and paying close attention if you have sleep apnea are all important to do. But when it comes down to doing those things and making the lifestyle changes to be healthier, it's hard. So don't be afraid to ask for help.
Ask them to involve their family and close friends with it, so you're all eating healthy or exercising more, or you're all trying to quit smoking together. I think those things are what make lifestyle changes work.
Gibson says it won't just happen one day.
You need a plan, and you need to do it consistently. After about 2 weeks, then it starts to become a part of your regular lifestyle.
Gibson has success stories about people changing the way they live to prevent a stroke. The workers at Visiting Angels Living Assistance Services have success stories about people who have had strokes and regained their abilities. Co-owners Robert and Amy Coburn say the mental component of avoiding depression after the stroke is important.
You're being encouraging and you're being patient, and it's not always going to happen real fast. Some days are easier, some days are harder, but you just keep doing it until they're able to do things that they could do before.
Use the acronym FAST to remember stroke symptoms: face drooping, arm weakness, speech difficulty, time to call 911. Coburn says if you can get to the hospital within 4 hours of noticing symptoms, it's possible to avoid permanent damage.
If you want to learn more about strokes, go to the American Stroke Association website. For 5 News, I'm Renata DiGregorio.